tone, and certain questions without any time limit. Okay, and you will guess your answer and you write your answer in the chat box, and then we will start the discussion. Okay, that what is the correct answer and why. And before I begin the session, can you please acknowledge, is everything fine at your end? Audio video is fine? If everything is fine, then let us start our session. So this is question number 1. Okay, a patient with the feature of dryness of the corneal surface of the eye. Why? Because of lack of tears. So that is the given presentation. And which of the following nerves may be damaged? So the hint here is we are looking at the name of the nerve which is responsible for the lacrimation. Okay, so look at all the choices and tell me what do you think will be the correct answer. Among all these given choices, what will be the correct answer? And the timer is going on. Quickly answer, and after that I will explain. Yes, now the time is up. Dear friends, answer to this question will be greater petrosal nerve, D. Why? Because that is the nerve of lacrimation. When we say the greater petrosal nerve is the nerve of lacrimation and we are looking at the lacrimation as such, why not we have marked the answer as the lacrimal nerve itself when the choice A was lacrimal nerve? Anyone? Can you tell why lacrimal nerve is not the answer here? Why only greater petrosal nerve? So let me explain. So what we can say that basically what happens, we have like one ganglion. The name of the ganglion is pterygopalatine ganglion. This is pterygopalatine ganglion where the greater petrosal nerve comes. The greater petrosal nerve will come, and this greater petrosal nerve is going to relay. After that, this input will be carried by zygomatic branch of maxillary, zygomatic branch of V2 maxillary nerve, which actually divides into two divisions, that is zygomaticofacial and zygomaticotemporal. Okay, and this is the distribution with the V2. But we do have the lacrimal nerve. Lacrimal nerve goes and supplies one gland. We all know which gland. It supplies lacrimal gland, correct? So what really happens, this zygomaticotemporal nerve will give one branch to the lacrimal nerve. Now, dear friends, if you make a lesion at the greater petrosal nerve, or at the ganglion, or at the zygomatic branch itself, or zygomaticotemporal, or the distal half of lacrimal. Why not proximal half? Because proximal half does not even have the lacrimatory fibers. So what the lacrimal nerve itself having? Lacrimal nerve itself is a sensory branch. It is carrying the sensation from the lacrimal gland and from the surrounding region. Is that okay? So if you cut the lacrimal nerve in the proximal half, only loss of sensation will be there, but there is no loss of lacrimation at this position. But if you cut in the distal half, then the sensory fiber will be gone, along with that the lacrimatory fiber will be also gone, and that is where there will be loss of lacrimation. I hope that makes sense. Could you appreciate this, everyone? So that is why answer was greater petrosal nerve. Now, dear friends, if you see this question, this is the timer. Which of the following reflexes test the integrity of the nucleus ambiguous? What is nucleus ambiguous? It is a compound nucleus of 9th, 10th, and 11th nerve. So, among the following reflexes, which of the reflex is mediated by the 9th, 10th, and 11th nerve? What is your answer? Yeah, write your answer in the chat box. Is it the jaw reflex, stapedial, gag, or corneal? Yes, very easy. So the answer to this question is gag reflex. Okay, so answer to the question is gag reflex because nucleus ambiguous means we are looking at afferent is ninth nerve, efferent is 10th nerve. Jaw jerk will be mediated by the trigeminal nerve only. Okay, jaw jerk is mediated within the trigeminal nerve. For the stapedial reflex, basically what happens for the stapedial reflex, we have the auditory nerve involved and then we have the seventh nerve involved because the seventh nerve gives one branch, if you remember, nerve to stapedius. When the high intensity sound is coming, it will dampen the high intensity sound. Okay, that is stapedial reflex. And what about the corneal reflex? Afferent will be the fifth, especially V1 fibers, and efferent will be seventh. So far, so good. So that is what answer will be C. Now, dear friends, we can say this question now. During a thyroid operation, a nerve which is coursing along with the superior thyroid artery is injured. During a thyroid operation, a nerve coursing along with the superior thyroid artery is injured. What can be the possible consequence? ठीक है, तो बेसिकली हमें ये बताना है कि मतलब सुपीरियर थायराइड आर्टरी के साथ कौन सी नर्व होती है पहले तो वो, फिर उसका एरिया ऑफ डिस्ट्रीब्यूशन या फिर मसल सप्लाई वट एवर इट इज डूइंग, व्हाट इज इट्स रोल, दोनों चीज़ों को कोरिलेट करना है. यस, कैन यू टेल बेटा? सो बेसिकली we have a mnemonic here. I hope you can remember the mnemonic. Yes, what is your answer? See, dear friends, we have this mnemonic, rise. You remember rise, what is that? Recurrent laryngeal nerve which accompanies inferior thyroid artery and external laryngeal nerve which accompanies superior thyroid artery. Now the nerve which is accompanying the superior thyroid artery is gone. Superior thyroid artery means external laryngeal nerve is gone. External laryngeal nerve is a motor nerve and it remains outside the larynx. So it has nothing to do with the sensation above or below. It is straightforward. Only role is to supply the cricothyroid muscle. That is why D will be the correct answer. I hope that makes sense. Let's look at the next question now. A patient, 31-year-old, complains of headache and dizziness after hitting a kitchen cabinet door. An MRI in the venogram shows a clot in the great cerebral vein of Galen. Okay, so that's the given history. The patient, after injury to the head, coming with certain complaints, and the clot is already found. The question here is the obstructed vein of Galen, right? Is it tributary of what? Which of the following category it belongs to? Now, can you tell, beta, this great cerebral vein of Galen is going to drain into what structure? Yes, quickly. It is going to drain into straight sinus. So basically what happens, we have the vein of Galen when it is formed, and from above inferior sagittal sinus is coming. Together they make straight sinus. And from above who is coming is superior sagittal sinus. From below who is coming is the occipital sinus. And then you have got confluence of sinus. That's now all these sinuses are nothing but dural venous sinus. Straightforward, D will be the correct answer. Next question, beta. Next question. Yes. Lesion of what will lead to Frey syndrome? Yes. Do you have any idea about the Frey syndrome? We discussed about it. Yes. And if you can find out which one is the Frey, like which nerve lesion will lead to the Frey syndrome? So you must be knowing this theoretically, first of all. And secondly, you have to, you see, identify also because the image is given and you have to identify the nerves. So, dear friends, can you tell me what do you think will be the correct answer? Hanji, write your answer in the chat box, Peter. Your answer may be right or wrong, hardly matters, but your participation is important. Very good, Peter. Very good. Afnan Abdullah, that's the correct answer, and you have identified also Auriculotemporal nerve damage. That's the correct answer, beta. Very good. So this A is the auriculotemporal nerve, okay? And if I show you, this is B is the deep temporal, which is going to supply the temporalis muscle. This is the buccal branch, which pierces the buccinator but does not supply it. This is the nerve to mylohyoid, because we can see this is the mylohyoid muscle. It is going there to supply the mylohyoid. Also, it supplies anterior belly of digastric. Even though it supplies anterior belly of the digastric also, but majorly the name is nerve to mylohyoid. Okay. Now the question is auriculotemporal nerve. Why? Because auriculotemporal nerve, if I explain this way, auriculotemporal nerve, it supplies the parotid gland, and from the parotid gland, obviously salivation will take place. That's the normal event. But we have another nerve, great auricular nerve. Great auricular nerve, when like it is normal circumstances, it is going to supply the skin over the parotid, which is for the sweating. Now, in case there is injury here, auriculotemporal nerve, while regeneration, it comes and joins with the great auricular nerve. So, what really happens when the input is given by auriculotemporal nerve for salivation, but that input will be reaching the skins, that is sweat glands, and eventually there will be gustatory sweating, or which is called as Frey syndrome. Frey syndrome, yes. Yes, pranam beta, pranam. Sabko pranam. Very good evening. Okay. And can you please tell beta सबको समझ आया है ये? Everyone, सबको समझ आया है ये Frey syndrome? Yes, this is Frey syndrome. सबको समझ आ गया? Everyone, have you understood this? Because understanding is very, very important. And which nerves are involved? Actually, two, auriculotemporal as well as great auricular. But yes, we have to mark one. We are going to mark auriculotemporal. That's the better answer. So far, so good. Let's look at the next question. This timer is again on, and now I can see that you guys are looking at the options. Quickly find out. Let me help you. What is paradoxical respiration? See, we have the two domes of the diaphragm, है ना? When the respiration will take place, both the domes will come down like this. But two domes are supplied by two phrenic nerve, left and right phrenic. If either of these nerve is gone, then that particular part will become flabby. The normal dome will keep on going downward. In case of inspiration, the normal dome is going downward, even that flabby one can't stay neutral, because during inspiration, the intrathoracic pressure is negative. It will move up. So this goes down, this moves up, paradoxical. When it is going up, it is pushing down like that. So we are looking at what? We are looking at what? We are looking at basically phrenic nerve, beta. Phrenic nerve, yes. Acha, so okay, you are waiting. Even I am also waiting for this cadaveric images classes. That class will start on 9th April. Okay, 12 noon we'll start and then we'll continue. ठीक है, जब तक हमें सारी clarity नहीं आ जाती, सारे topics पे all the important cadaveric images we are going to discuss. Okay, on the same day, one session. Okay, one session मतलब पूरा सारा images को खत्म करेंगे हम, right? And answer to this question will be A, because we are looking at phrenic nerve, right? And let me help you here. What is this muscle? This muscle is the scalenus anterior muscle. What is this muscle behind is the scalenus medius muscle, correct? Now just anterior to scalenus anterior, मतलब जो एकदम उसके साथ सटी हुई है, that nerve A. What is A is phrenic. What is A is phrenic. And what is B? B is vagus. And what is C? C is sympathetic fibers. And D is the recurrent laryngeal nerve. Yes, very good अफनान, आपका अंडरस्टैंडिंग बिल्कुल करेक्ट है. एक फ्रैनिक है और एक वेगस है. आप कैसे पहचानोगे? What your confusion is, it's like maximum students confusion, but let me tell you, whenever you are looking in the root of this neck region, why I'm saying this, because relationship will alter later on. So let me tell you both. First, when we're looking at the neck region, जो जस्ट मसल के इंटीरियर है वो है फ्रेनिक, जस्ट एंटीरियर टू द मसल इज फ्रेनिक, and further anterior is vagus. So who is overall anterior? Vagus. But when you look at the hilum, okay, in front of the hilum, phrenic will be there. Behind hilum, vagus will be there. So who is overall anterior? Phrenic. So relationship has changed while reaching the thoracic region. Is that okay? याद रखेंगे अभी हम. Will we be able to answer next time onward? चलो अब बताओ इसका आंसर क्या बनेगा. A patient has been brought to the emergency department unconscious after a motor vehicle accident, but there is a skull fracture at the junction of frontal, parietal, temporal, and sphenoid bone. What is this junction? This junction is nothing but pterion. And from our exam point of view, this pterion is very, 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 very important. Okay. So which artery is present? Which artery is present deep to it? The name of the artery will be middle meningeal artery. The name of artery will be middle meningeal artery. And if I ask you specifically which division of middle meningeal artery, that will be anterior division of middle meningeal artery. But this middle meningeal artery is a branch of what? Maxillary. That's why B will be the answer. Do you appreciate this? So far, so good? Very good, but a middle meningeal artery, and that is why it's a branch of maxillary. So we'll mark B as the answer. Good. Yes. Afnan, Amit, all of you are correct. Very good बेटा, है ना? So ऐसे ही धीरे धीरे हम सारी चीज़ों को पिकअप करेंगे. आगे बढ़ने से पहले if I ask you, if they ask about artery, we will say this, what we have just now discussed. But by chance, if they ask which bony landmark is present deep to the pterion, I have talked about this in the class. Can you recall from the class? Which bony landmark? That will be lesser wing of sphenoid. That will be lesser wing of sphenoid. And after this, if at all they ask which part of the brain matter, then we can say stem of lateral sulcus. These are the three things which will be present in relation to pterion, deep to the pterion rather, right? Very good, beta. Correct answer. Now the next question. Look at this question. Patient has come to the emergency. Sudden onset vision loss is there. Okay. And he has a history of coronary artery disease. BP is given and pulse is given, but eventually the patient is having certain retinal whitening, etc. And the question is, there is an embolus in the artery and which has blocked the artery, leading to the features of the patient. But how the embolus must have reached the retina? How the embolus must have reached the retina? So see, if such type of question, don't go in a like prospective, you go in a retrospective. So retinal artery will be the answer. So retinal artery is given in all four choices. Fine. But retinal artery is a branch of ophthalmic. So A can be answer, B can be answer, C and D cannot be the answer. वैसे रूल आउट हो गए ये, क्योंकि वो क्यों रेटिनल आर्टरी इनसे तो आती नहीं है. It's a branch of ophthalmic. Now coming further, we know ophthalmic artery is a branch of internal carotid, not from external carotid. So B will be the correct answer. Could you understand? Very good, beta. All of you are correct. Afnan, Amit, XYZ, all of you are correct. Next question, beta. Third week of the development is characterized by the appearance of the branchial apparatus. Although branchial apparatus is an older name, sometime might be given. So anyway, embryonic primordium from which head and neck structure will be derived. Which of the following structure will be developed from the second pharyngeal arch? If you can recall in the class, I use certain mnemonics and the tricks particularly for the pharyngeal arches. और हमने बार बार इसको रिवाइज भी करा था, याद है आपको? Can you recall that we use the mnemonics and the tricks and then we recall number of times so that In the class itself, you could memorize this. Yes, yes, dear friends. तो क्या आंसर बनेगा? From the first pharyngeal arch was anterior belly of digastric. From the second pharyngeal arch, it will be posterior digastric. Okay. So anterior digastric comes from the first arch. And if you can recall, let me tell you, there was one mnemonic. Let me revise here also. The mnemonic was my must aunt digest tension. What is my is mylohyoid. What is must is mastication group of muscle. Undigest anterior belly of digastric. And then we have two tensors, that is tensor veli palatini and tensor tympani. Now dear friends, from here we can derive the second arch derivatives, particularly muscles. How? We have mylohyoid here and the similar name starting with the letter S because second arch starts with S. So from the second arch we have stylohyoid. And then we have group. Of which group? Facial expression. Then from the first arch anterior digastric. So from the second arch there will be posterior digastric. Lastly stapedius. Lastly stapedius. बिल्कुल सही बात है अमित, ये तो दैट्स द करेक्ट वे ऑफ नोइंग इट. फेशियल नर्व से सप्लाई लेने वाले सारे के सारे सेकंड आर्च से आएंगे क्योंकि सेकंड आर्च की नर्व सप्लाई फेशियल नर्व होती है. वेरी गुड, सो फार सो गुड. तो आप कैसे भी लाइक यू यूज एनी ट्रिक एनी मेथड, इवेंचुअली यू मस्ट नो द आंसर. ठीक है, तो अगले क्वेश्चन पे आएंगे, पढ़ेंगे क्वेश्चन को एवरीवन. A 43-year-old man has new onset of difficulty with speaking. Examination reveals problems in elevating the hyoid bone and the floor of the mouth, secondary to the paralysis of the posterior belly of the digastric muscle. Which of the following nerve is most likely involved? Now, dear friends, when I have seen some students, because they ask these doubts in the messages and all, so some students they get confused, like they kind of thinking in their mind like who is elevating the hyoid bone and the floor of the mouth and all. You don't have to really think about it. Why? Because that is given in the question. Question itself says there is a paralysis of posterior belly of the digastric. So you don't have to focus on the other muscles. You have to focus only on this muscle. And then you have to think posterior belly of digastric is a derivative of which arch? Second arch. Second arch. What's the nerve supply? Facial nerve. D is the correct answer. Do you appreciate now? Next question. Pre-traumatic nerve of first pharyngeal arch is. What do you think will be the answer? Very easy, conceptual, and discussed in the class. Now let us, with this question, let us revise the nerve supply of tongue. Okay, we have three parts of the tongue and let us discuss. Let me write over here anterior 2/3. In this we have general sensation and we have taste sensation. Posterior 1/3 all sensation, and posterior most part of the tongue all sensation. Yes, dear friends. Anterior 2/3 who will be supplying here? Lingual. For the taste, chorda tympani. Posterior 1/3 everything, ninth nerve. Posterior most part, internal laryngeal nerve, which is a branch of superior laryngeal nerve. That means that belongs to vagus nerve. Very good, beta. Taste sensation is 7th, 9th, and 10th. So we can simply straightforward remember like that. But the point here is the 7th nerve, which is a nerve of second arch, that does not make the tongue. There no like in the final formation of the tongue, there is no contribution. So why coda tympani is there? That's the pre-traumatic of the first pharyngeal arch. Meaning is it will be distributed in the first arch territory. Actually, it's a branch of second arch nerve. but the distribution area is the first arch territory. So this is where it is going to be. Is that all okay? So, like if I explain, we have the first arch, we have the second arch. For the first arch, which is the nerve, mandibular nerve, that is called as post-traumatic branch. For the second arch, which is the nerve, facial nerve. But facial nerve gives one branch in the territory of the first arch, and this is chorda tympani, which is pre-traumatic for the first pharyngeal arch. I hope that makes sense now. Yes, very good. Palatoglossus will be supplied by the VAC. All others will be supplied by the hypoglossal so far as motor supply is concerned. And rest all we have written here. Very good, Amit. Correct. Shabash, beta. It is good to see that my students are remembering everything and they are prepared for the exam. Like whatever format the exam might come, my students are going to rock. Damsonians are going to rock. Very good. It gives me immense pleasure and pride. Next question. A patient presents with hyperacusis, loss of lacrimation, and loss of taste sensation in the anterior two-thirds of the tongue. Inflammation extends up to which level of the facial nerve? Now, you have to understand what is gone in the patient. Taste sensation is gone. So, we are looking at higher than chorda tympani. Hyperacusis is there. So, we are looking above the nerve to stapedius. But the loss of lacrimation, that's the highest level. Genu, even the genu is also involved. So we can say it is proximal to geniculate ganglion. Proximal to geniculate ganglion, because geniculate ganglion is the one which gives greater petrosal nerve. Could you recall, beta? Yes, let me quickly give you the overview of this particular part. So if I say that we have the seventh nerve coming, we have the seventh nerve coming like this, making a bend and going behind. From this part, this is greater petrosal nerve for lacrimation. This is where it gives one branch nerve to stapedius. This branch is chorda tympani, and then the nerve comes out of the foramen. Okay, these branches were given where, like in the middle ear, but then it comes out of stylomastoid foramen. So if there is a cut over here at this region, there will be facial palsy. Cut over here, facial palsy. Additionally, there will be loss of taste. But if the cut is here, then there will be hyperacusis. But if there is proximal to the geniculate ganglion, then there will be loss of lacrimation as well. Is it clear to everyone? Yes, very good. And good to see all of you are correct. Next question. Which structure can be felt at the lower border of the medial border of sternocleidomastoid? So this is something which is factual, that we are looking at this part, okay, inner border, you can say medial border of the sternocleidomastoid, and we are looking at carotid pulsation here, right? This is a factual question, and answer will be common carotid artery. And we have one tubercle over there, okay, at the level of C6. Next question. Glossopharyngeal nerve, it supplies parasympathetic fibers to which of the following gland? Yes, glossopharyngeal nerve. Quickly answer. Glossopharyngeal nerve will be giving parotid gland, because from the glossopharyngeal nerve we have lesser petrosal nerve which is coming, lesser petrosal nerve involving otic ganglion, and via the otic ganglion which gland will be supplied? Parotid gland. For these two glands, the fiber will be given by chorda tympani. For the lacrimal gland, greater petrosal nerve. Yes, now we are looking at oral cavity behind the teeth, that means within the mandible. Okay, we are giving at one block. Which block? Here we have one nerve which is going to enter, as we understand it, and that is what is being blocked over here. Inferior alveolar is the correct answer, beta. All of you are correct. And it is very good, beta. XYZ and other students, like, you are not only answering correct, you are giving good explanation as well. That's very nice to see. Even ganglion also you have mentioned. Very good. Now there's no timer and you tell me this. All structure pass through the foramen ovale except, you remember ovale and we had the mnemonic male. याद है आपको? तो यहाँ पे कुछ कुछ क्वेश्चन ऐसे डायरेक्ट हैं, लाइक वी डिस्कस द फोरामेन ऑफ स्कल इन डिटेल, है ना? उसको हमने न्यूमोनिक्स भी बनाए थे. ओवेल में मेल था. व्हाट वाज एम? मैंडिबुलर नर्व. व्हाट वाज ए? एक्सेसरी मेनिंजियल आर्टरी. व्हाट वाज एल? लेसर पेट्रोसल नर्व. व्हाट इज ई? एमिसरी. अगर आप देखो तो यहाँ पे न्यूमोनिक तो बन रहा है एम से मिडल मेनिंजियल, बट नो, that M is mandibular nerve. We need to remember ovale से mandibular nerve pass होती है, right? And middle meningeal artery will pass as a men structure. From which foramen? From the foramen spinosum. What is men? M for middle meningeal artery, E for emissary vein, and N for nervous spinosum as per the name of foramen. So answer will be B. Do you remember? Very good, beta. All of you are correct. Next question. Mass in jugular foramen may result in all except. What do you think? Jugular foramen. Before jumping on to the conclusion, tell me, from the jugular foramen, which cranial nerve will pass? From the jugular foramen, which cranial nerve will pass? That will give us a hint about this question. From the jugular foramen, we have 9th, 10th and 11th nerve, right? So difficulty in the swallowing, that is because of the pharyngeal involvement, or you can say like 10th nerve is majorly there. Hoarseness, that is because of laryngeal involvement. And difficulty in turning the neck to the opposite side, that is because of the sternocleidomastoid muscle, and sternocleidomastoid is supplied by the cranial root of spinal accessory nerve, spinal accessory nerve, because spinal accessory nerve is the one which is going to supply two muscles. Can you tell? Spinal accessory nerve is going to supply sternocleidomastoid, and what is the second muscle supplied by spinal accessory nerve? Yes. So these will be seen because of involvement of the jugular foramen. What will be not seen is D. Very good. Answer is D, beta. Very good, beta. Correct. And the next muscle which is supplied by the spinal accessory nerve apart from sternocleidomastoid is trapezius. For the trapezius, I told you in the class that we have two important terms. Either there will be term shoulder droop or shoulder shrugging. You remember? Shrugging of the shoulder. Very good. Correct. All of you are correct. Yes. Next question. Structure not injured in the submandibular gland excision. Now this is something very, very important with respect to the relationship of the submandibular gland, submandibular duct and the nerves. Yes. Now, for those who have not seen this image before, let me tell you what if this is a submandibular gland and what if this is a submandibular duct. And here you can see the lingual nerve looping around the duct. It's a long back PYQ who loops around the duct. L for lingual, L for loop. Lingual nerve loops around the duct. And this is the nerve, hypoglossal nerve, which is very close to this, but it is not looping around. But basically what we can say, if at all you are operating in this region, these two nerves are at high risk of injury, isn't it? So when the question says Structure not injured means we are looking at what? Least likely to be injured. Least likely to be injured, lingual nerve cannot be the answer, hypoglossal nerve cannot be the answer. Now we are left with A and D. And you have already marked, beta, you have already marked, yes, you have marked A answer. That is correct. Because if at all, I'll explain this. We have A and D choices. Actually, both of them are not in direct relationship. So you can think of both, but you have to mark one answer. Now, let me give you this hint. Marginal mandibular branch is a like kind of superficial branch over here. But inferior alveolar nerve is well protected within bone. So who will be least likely to be injured? Who is well protected or who is superficial? Obviously, the well protected within the bone is least likely to be injured. That's why we are going to mark answer as a very good. हाँ जी, ये बिल्कुल सही बात लिखी है आपने अमित कि वो कैनाल में होती है तो प्रोटेक्टेड हो गई तो नेचुरल सी बात है कि वो इंजर्ड नहीं होगी। सही है, एवरीथिंग फाइन, सबको क्लियर है, वेरी गुड। अब आपने नेक्स्ट क्वेश्चन बताना है बेटा। Patient recovering from traumatic injury to the face now finds himself unable to chew the food, and on physical examination, Joe is deviated to the right side. The nerve that has been injured in the patient exits the skull through which of the following phenomena? During the class, also, I told you whenever we get this type of question on the neuroanatomy, always we have to see what is the deficit in the patient. We have to see the sensory deficit as well as we have to see the motor deficit. And based on that deficit, we have to think in our mind what can be the level of the lesion, okay, or which particular nerve is involved. In this case, what is happening? In this case, patient is not having any sensory deficit. First of all, sensory deficit तो है नहीं, only motor deficit is there. And what motor deficit? Patient is having inability to chew. The mastication itself is gone, which is done by muscles of mastication. That's the first hint. Second hint is jaw is deviated. Again, the jaw movements are done by the muscle of mastication. Eventually, we are looking at the muscle of mastication which are paralyzed. Why? Because the nerve supplying them is gone. What is the nerve supplying them? Mandibular nerve. So, like tracing back, we have found out that mandibular nerve is gone. So, what will be the foramen? That means foramen will be foramen ovale. सबने सही आंसर लगाया है, ना केवल सही आंसर लगाया है, इट्स गुड टू सी कि सबको एक्सप्लेनेशन भी बहुत अच्छे से समझ में आया। दैट इज वेरी वेरी गुड बेटा। ठीक है, चलो आगे बढ़ने से पहले अब आप लोग एक छोटा सा क्विक फीडबैक, हाउ यू आर फाइंडिंग दिस क्विज टुडे, लाइक आपको सोल्व करके कुछ एक बूस्ट मिला और रिवाइज करने का चांस मिला, या व्हाट इज योर थॉट्स अभी तक का? फिर आगे बढ़ेंगे, कुछ क्वेश्चंस बाकी हैं, 25 तक हैं, अभी हम 19 तक आए हैं, 6 क्वेश्चन बाकी हैं। बूस्ट मिला थोड़ा सा? देखो, यू हैव टू स्टे कनेक्टेड विद द स्टडीज आइदर वे, चाहे आप उसको रिवीजन करके करते रहो, चाहे आप क्विज अटेंड करो, है ना, चाहे आप उसको लाइक विजुलाइज करो, कैसे भी, अल्टीमेटली यू हैव टू स्टे कनेक्टेड। एंड ऑन माई टेलीग्राम ग्रुप ऑल्सो आई एम टेकिंग सर्टेन क्विजेज, अगेन न्यू साइकिल इज अबाउट टू स्टार्ट। ठीक है, आई विल गिव द schedule for that. And on my Instagram also I am putting the questions, and I am you see conducting putting certain updates also, है ना। तो ये अच्छी बात है। हाँ बेटा, ये आपने बहुत अच्छा सजेशन दिया। देखो, एक स्टूडेंट ने बहुत अच्छी बात लिखा, बाग कंसेप्चुअल क्वेश्चन है, वेरी गुड, थैंक यू बेटा, हेल्पफुल लगा, वेरी गुड, मुझे भी अच्छा लगा। अब एक बच्चे ने अच्छा सजेशन दिया है कि जो नहीं आ पा रहा था वो भी कवर हो रहा है, मतलब आपको एंजॉय भी हो गया, रिवीजन भी हो गया, और कुछ नया भी सीखने का मौका मिल गया। तो ये तो विन विन सिचुएशन है। वेरी गुड, आई एम वेरी हैप्पी, है ना। चलो, ऐसे ही करते रहना बेटा, हमेशा कनेक्टेड रहो, ठीक है। कुछ ना कुछ एक्सक्यूज बना के आप अच्छा काम ही कर रहे हो, पढ़ाई कर रहे हो, क्विज कर रहे हो, हमेशा कनेक्टेड रहो। बहुत बढ़िया, आगे बढ़ते हैं बेटा, है ना। और मैं यहाँ पे ना आपके साथ एक ये शेयर कर रहा हूँ, मेरा जो इंस्टाग्राम और टेलीग्राम जो मैंने बताया है, जहाँ पे मैं क्विजेज वगैरह कंडक्ट करा रहा हूँ ऑलरेडी और जहाँ पे मैं अपडेट्स दे रहा हूँ, ये है मेरा। ठीक है, आप जस्ट इसको एक बार, आप अगर आप भी सोशल मीडिया तो यूज़ करते ही होंगे, तो dr_संदीप_मदान है। और ये मेरा यूट्यूब चैनल है। ठीक है, और ये है टेलीग्राम। इस पे क्विजेस और अपडेट्स आपको सीखने का मौका मिल जाएगा। जैसा मैंने कहा, जस्ट स्टे कनेक्टेड, उससे ही आपको बहुत हेल्प मिल जाने वाली है। ऑलराइट, ठीक है डियर फ्रेंड्स, अब आगे बढ़ते हैं और क्वेश्चन 19 तक हमने कर लिया हुआ है। अब हम लोग 20 ऑनवर्ड्स पढ़ते हैं। ठीक है, एंड आई होप कि आप ऐसे ही मोमेंटम मेंटेन रखेंगे और करेक्ट आंसर देते चलेंगे। राइट, चलो बहुत बढ़िया। अब ये क्वेश्चन है, अ शार्प इंस्ट्रूमेंट पासिंग थ्रू द सुपीरियर और बैटल फिशर वुड मोस्ट लाइकली सेवियर विच ऑफ द फॉलोइंग स्ट्रक्चर। क्वेश्चन क्या है, इंस्ट्रूमेंट पासिंग थ्रू द फिशर मीन्स इनडायरेक्टली क्या पूछा जा रहा है, that who will be passing through the fissure, the one who is passing through the fissure will be injured because instrument is there only. So we have to say now which of the following is passing through the superior or orbital fissure. Yes, and answer is straightforward, a abducens nerve, because we know third, fourth, sixth and V1 fibers will be passing from the superior orbital fissure. What about the facial nerve? It passes through internal acoustic meatus. It passes through internal acoustic meatus but exits from stylomastoid foramen. For the facial nerve, you need to remember these two. Mandibular nerve, foramen ovale. What about maxillary nerve? I told you maximum round. Maximum matlab maxillary, round matlab rotundum. Foramen rotundum. All right. Now the next question is Dorello's canal. Yes, who can answer this? Dorello's canal, beta. Dorello canal, कोई बता सकता है? Dorello canal is the name given to the dural canal where we have abducens nerve passing through. If I ask you who is having the longest intradural course, that will be sixth nerve only. But if I ask you who is having the longest intracranial, can you tell beta? Longest intracranial nerve, that will be fourth nerve. Why? Because it comes dorsally first. It exits dorsal, winds around, travels ventral. So पूरा घूम के जाती है, इसलिए longest intracranial हो जाता है. लॉन्गेस्ट इंट्रा ओसियस, बोन में कौन सबसे ज़्यादा ट्रेवल करती है, वो है सेवेंथ, बिकॉज इट गोज इन टू द, यू सी, पेट्रस पार्ट, अप्रोचेज द मिडल ईयर, राइट, एंड देन पूरा ट्रेवल वहाँ पे बेंड बनाती है, गोज वर्टिकली डाउनवर्ड, कम्स आउट स्टाइलोमेस्टोइड फोरामेन, दैट्स हैविंग द लॉन्गेस्ट इंट्रा ओसियस. एंड ओवरऑल लॉन्गेस्ट, सबसे ज़्यादा लॉन्गेस्ट, कुछ कंप्लीट लॉन्गेस्ट क्रेनियल नर्व, longest cranial nerve, that will be 10th, because वो head neck पे end नहीं होती, it comes in the thorax region, it comes in the abdomen and it supplies up to the midgut level, so it has got the longest course. Which one is the thinnest? Thinnest will be again fourth. But who is thickest? Thickest will be fifth nerve. Yes, yes, Saima, that is true. This video will be uploaded and you will be able to see this video. For later use, yes, it will be available. GIT तक भी जाती है, वेरी गुड, ये बहुत इंपॉर्टेंट पॉइंट है, मिडगट तक जाती है, वेरी गुड बेटा. अब ये बताना है आपने, ये किसका एरिया है? आईएनआई का. क्यों? आईएनआई वाले इस इमेज को एक दो बार पूछ चुके हैं ऑलरेडी. तो अभी कैसा है, हमें सब आना चाहिए. तो लेट अस स्टार्ट फ्रॉम हियर. वी हैव क्रेनियल नर्व 1 ओवर हियर. दिस इज cranial nerve 2. This mark is the 3, so the third will be the answer. This thinnest will be fourth and the thickest will be fifth. And I told you in the class that if you are going in this direction, so let me zoom in to show you. हम कैसे आ रहे हैं? ऐसे. और हम देख रहे हैं 1 2 3 4 5, तो आगे 6 होगा? नो, 6 यहाँ है, कहाँ है? 6 is going forward and piercing the dura, entering into a canal. The name of the canal is duralis canal, which is dural canal. Okay, so this is where we have the 6th nerve. This is 6th. This is 7th and 8th, which is entering within the bone. Then we have 9th, 10th, 11th and 12th. This video and this annotated PDF, ये जो मैं लिख रहा हूं यहाँ पे, this will be uploaded, okay, on the eMedicoz app. This will be available for you guys, और वीडियो YouTube पे भी अवेलेबल रहेगा. और अगर किसी को फाइंड आउट करने में डिफिकल्टी आ रही है, कॉन्टेक्ट मी, DM मी ऑन माई इंस्टा. आई विल हेल्प यू इन गेटिंग दिस. ओके, नेक्स्ट. अब ये आपने आइडेंटिफाई करना है. अ पेशेंट हैज कम टू अस with the primary position like this. When we ask him to look to the left side, patient can see, no problem. But when we ask the patient to look to this side, patient can't see. यानी कि ये वाली रेक्टस उसकी काम नहीं कर रही. बेटा आप बताओ कौन सी रेक्टस काम नहीं कर रही? ये लैटरल रेक्टस है. लेकिन मैंने आपको क्या बोला है, हमेशा you make a habit as a good clinician, make a habit of making a complete diagnosis. Instead of saying lateral rectus not working, we can say right lateral rectus is not working. So what's our answer? Like which nerve is gone? Right abducent nerve is gone. But of course in the question there is nothing left, right? So answer will be abducent nerve. But हमें आना तो complete चाहिए, right? So answer is abducent nerve. Fine. चलो, अब ये क्वेश्चन, ये बताओ क्या आंसर है. आई होप कि ये भी सभी लोग बताएंगे. नॉर्मली व्हेन वी टच द कॉर्निया, ओके, bilateral reflex is seen, but you are touching the right side. Left blink is there, right blink is absent. So first of all, you are touching the cornea and one side reflex is there. मतलब afferent का तो कोई loss है नहीं, है ना. ब्लिंक के लिए एफरेंट होता है 5th नर्व V1 एंड इफरेंट होता है V2, सॉरी 7th नर्व, फेशियल नर्व, राइट. तो लेफ्ट साइड ब्लिंक पॉसिबल हो रहा है, तो लेफ्ट में देर इज नो एरर, ओनली द डिफेक्ट लाइज ऑन द राइट साइड. तो लेफ्ट वाली चॉइसेस तो वैसे रूल आउट हो जाएंगी, लेफ्ट में कुछ भी प्रॉब्लम नहीं है. अब बचे C और D. If at all trigeminal is gone, trigeminal is gone means afferent is gone. If afferent is gone, there is no reflex. So obviously answer will be D. अब इसको सबको समझ आया है ये क्वेश्चन? बताएंगे चैट बॉक्स में, हैव यू अंडरस्टूड दिस और शुड आई एक्सप्लेन विद द हेल्प ऑफ द डायग्राम? एक बार क्विकली एक्सप्लेन कर दूं. सो लेट मी ड्रॉ दिस डायग्राम बेटा, है ना. यहाँ पे हम डायग्राम ड्रॉ करके सिखा देते हैं. सो सपोज दिस इज ब्रेन स्टेम. This is midbrain, this is pons and this is medulla. ठीक. This is cornea right side, this is cornea left side. Above the cornea and below we have the lids are there ना, blink के लिए तो lids चाहिए होती हैं. And we have the muscles, right? Which muscles? These are the muscles of facial expression, orbicularis oculi. And here we have, like, whenever we touch the cornea, our input will be taken by this nerve V1, which is the afferent nerve, where it will take to the nucleus. Where is the nucleus position? Pons. Which nucleus? 5th nucleus. Now the trigeminal nucleus will fire and it will stimulate bilateral 7th. मतलब ipsilateral 7th को तो सप्लाई कराएगा ही, कॉन्ट्रालेटरल वाले को भी सप्लाई करा देगा. ये इसका एक स्पेशल फीचर है. एंड दिस इज द 7th नर्व न्यूक्लियस, दिस इज द 7th नर्व न्यूक्लियस ऑफ दिस साइड. तो यहां से नर्व आई, सप्लाई कराया, नर्व आई, सप्लाई कराया. So that means normally what happens, we touch here, Input goes like this. Input goes like this on both sides. Input goes like this on both sides. This muscle contracts. This muscle contract. Blink is seen. That's normal. Have you understood बेटा? यहां तक क्लियर है? अब क्वेश्चन क्या कह रहा है? आपने टच किया राइट साइड and what is happening? Left reflex present, right reflex absent. That is only possible if right facial is gone. That's why rest of the pathway is still working and the right side it is absent. Right facial is not working. That's why muscle is not contracting. Blink is absent. If you guys have understood this particular portion, I will change the language of the question little bit. What is that? Now, suppose this patient is gone. A new patient has come. A new patient has come where we already know that his trigeminal nerve is not working. This is given in the question that trigeminal nerve is not working for this new patient. And on the right side, okay, and you are touching the right cornea. तो आपने right cornea को touch किया, right trigeminal work नहीं करती है. Question ये है कि अब किस साइड में reflex absent होगी? If the trigeminal nerve is not working, on which side reflex will be absent? अमित दैट इज मोस्ट लाइकली लेशन अगर उसका वहां पे भी हो सकता है वैसे तो है ना बट दैट इज करेक्ट दोनों साइड में एब्सेंट होगा दैट इज इंपॉर्टेंट हेयर वेरी गुड नो रिफ्लेक्स वेरी गुड ऑल ऑफ यू आर करेक्ट नो रिफ्लेक्स that's important if it is bilaterally absent means afferent is gone then trigeminal will be the answer but if it is unilateral absent in that case facial nerve will be absent on the affected side very good chalo bahut अच्छे now the last question all of the following structures are pierced by the parotid duct except answer to this question will be C. And how to remember this? Let me help you. Remember, parotid duct is going to pierce BBBM. ठीक है BBBM है पहला तो न्यूमोनिक B से क्या है बक्कल एवरीथिंग इज बक्कल हाउ बक्कल फैट B is buccal fat then buccal fascia. What is buccal fascia? Means buccopharyngeal fascia. Then buccal muscle. What is the muscle with the name buccal? That is buccinator. Buccal pad, buccal fascia. Which fascia? Buccopharyngeal. Buccal muscle. Which muscle is there in the buccal? That is buccinator. M is mucous membrane. So please remember this. Here we don't have any word buccal. So everywhere we have BBB, buccal fat, buccal fascia, buccal muscle, that is buccinator, mucous membrane, and it goes parallel with the masseter. It does not pierce the masseter. I hope you will remember this. याद रहेगा सबको? ठीक है बेटा. So that was all for today. So today's discussion is over. It was nice meeting you guys. Stay connected. Okay, if you have any doubt, you can ask me on these medias. Okay, and we'll meet in the next session. And anyway, on the 9th April, I'm coming live. वहाँ पे हम कैडावरिक इमेजेस के ऊपर बेस करके सारे क्वेश्चंस की प्रैक्टिस करेंगे जिससे कि INI के लिए it will be helpful for you guys. All right.